There are 4 speakers of this breakout session 3. Let me briefly introduce the speakers through video on the screen.
Okay, thank you, and I want to welcome you all to the Biotechnology and Healthcare panel. Annyeong Hashimika, and that is all the Korean you will hear from me. I want to thank, first of all, the other members of the panel, and I will tell you a little more about them in a minute. And I want to thank you as well for choosing to come to this panel. I know this whole conference and all the other panels, of course, are about the most important technologies and industries of the future, with tremendous opportunities for Korea, for business, technologies that will change the world. And in fact, I apologize that you can't go to the other panels because you're here. But if I dare say it, I think this panel is special because in addition to all the business impacts, the topics we will discuss today are literally life and death. We will be discussing issues that affect our health, our childbearing decisions, our longevity, even the future of the human race. As scientists explore and continue to map out DNA in our genome, they are learning things about our physiology and our genes that will lead to tremendous knowledge that can be used for good or not so good. On the good side, this knowledge could clearly lead to drugs and products that can help improve our health and extend our life. And also just information that can help us change our lifestyles to live better lives and perhaps avoid diseases that we have genetic tendencies toward. Help us decide, make our child-raising decisions based on whether we might be carriers of genetically born diseases. But on the other side, there are some potentially frivolous or even dangerous uses this knowledge could be used for. Things like designer babies, drugs that induce a sort of false happiness, a society of 2 different levels where some people can afford this advanced medicine and having their genes mapped, and some who can't. So these are all issues that I hope we'll explore this afternoon. And I'd like to tell you about the panel members who will be exploring and discussing these issues, just in alphabetical order. Dr. Phu Phat Ka. Dr. Phu has been involved in biotech investment for many years, starting as an equity analyst in London and moving on to become head of equities for SG Securities Asia, finally ending up as an advisor and investor. He recently started a new fund, Luminor Capital, based in Singapore, which invests in 3 sectors that it believes to be the key sectors for the next decade: resources, renewable energy, and recombinant technology or biotech. Dr. Phu is also the founder of Maida Vale Associates, which is an investment and advisory firm specializing in healthcare, also based in Singapore. And he's a venture partner for Aravis Ventures, which is a global biotech and renewable energy fund, with investments in Asia, Europe, and the US. He was one of the founding members of Bio Singapore, the country's industry association for the bioscience industry, and he served as its honorary treasurer from 2004 to 2006. He has degrees in medicine and an MBA from Queen's University in the United Kingdom. Another panelist is Professor Sang-Yup Lee. He is a distinguished professor in the Department of Chemical and Biomolecular Engineering at the Korea Advanced Institute of Science and Technology. He is also currently the Dean of the Institute's College of Life Sciences and Bioengineering, Director of the Center for Systems and Synthetic Biotechnology, Director of the Bioprocess Engineering Research Center, and Director of the Bioinformatics Research Center. He has published more than 330 journal papers and more than 50 books and book chapters, and has been awarded more than 450 patents. Among the numerous awards he's received are the National Order of Merit, the Merck Metabolic Engineering Award from the U.S. pharma company Merck & Company, and the Elmer Gaddon Award in Biotechnology and Bioengineering. He is currently a fellow of the AAAS, of the American Academy of Microbiology, and of the Korean Academy of Science and Technology, as well as a foreign associate of the U.S. National Academy of Engineering. And he's editor-in-chief of the Biotechnology Journal, an associate editor and board member of numerous other journals. His research interests are metabolic engineering, systems biology and biotechnology, synthetic biology, industrial biotechnology, and nanobiotechnology. Now, you did meet Professor Gregory Stock this morning, but let me tell you about him some more. He is a biotech entrepreneur, bioethicist, best-selling author, and a leading authority on the broad impact of genomics and other technologies in the life sciences. He founded the influential program on medicine, technology, and society at the School of Medicine of the University of California at Los Angeles in 1997 and served as its director for 10 years. In 2004, he co-founded Signum Biosciences, a Princeton University spin-off created to develop a new class of anti-inflammatories and therapeutics for neurodegeneration. He served as CEO for 6 years, directing efforts there to develop promising pharmaceutical candidates for Alzheimer's and Parkinson's diseases. His book, Redesigning Humans, Our Inevitable Genetic Future, won the prestigious Kistler Book Prize for Science Books and was nominated for a Wired Rave Award. His Book of Questions, which has sold over 2 million copies, has been translated into 18 languages, including Korean. He serves on the California Advisory Committee on Stem Cells and Reproductive Cloning and is the Associate Director of the Center for Life Science Policy Studies, a think tank at the University of California at Berkeley. He has a doctorate in biophysics from Johns Hopkins University and an MBA from Harvard University. And Mr. Jung-Jin Suh. He is the CEO and chairman of Celltrion, a global biopharmaceutical company founded in 2002 that specializes in biosimilar products as well as innovative new drugs. He is also vice chairman of the Korea Biotechnology Industry Association. In his career, he has combined really the two key technologies we'll be discussing today, infotech and biotech. He began his career at Samsung Electronics in 1982 and worked as a consultant at the Korea Productivity Center for 5 years. Between 1992 and 1999, he was executive director at Daewoo Motor Company. He is also a director of the Korea Youth Association, and he served as a judge for the Entrepreneur of the Year Award in 2009 that's presented by Biospectrum Asia Pacific. After graduating from Konkuk University with a Bachelor of Science degree, he later went on to receive an MBA from his alma mater. And last year, he won the $100 million Export Tower Award given by the Korea International Trade Association. Now, this morning you heard Professor Stock's speech. I'm just going to summarize it really briefly to refresh everyone's memories because the other speeches will soon be very fresh in your memories. He was explaining, what is going on in the labs and some of the dramatic implications for the future of really two revolutions that he mentioned, the genomics and the silicon revolutions. And there are incredible business potentials as well as other potentials. As he noted, the possibility of seriously modifying human biology has already affected medical and healthcare industries, and in the future it could affect a huge swath of the economy, extend the human lifespan, alter our child-raising decisions, alter our emotions, and really challenge, as he said, challenge what it means to be human. Now, there are many business opportunities, and as he pointed out, Korea is particularly well positioned with its research into stem cells. And at any rate, the opportunities are really just beginning here. He also talked about some of the implications for healthcare. As he put it, the healthcare will become more preventive, predictive, personalized, and participatory. And this will change the relationship between patients and their doctors. He also went into an analysis of where the drug industry stands, both the big pharmas and the small biotechs, and the different positions they're in. As he pointed out, big pharma faces many challenges, including, high research and development costs, toughening regulation, which it's a discussion I hope we'll get into later on regulation, anemic pipelines, mounting difficulties of getting reimbursement. Nevertheless, he said that big pharma is in a strong position because it has, large revenues, large cash reserves, and large demand. As you well know, in Korea, with the aging of the population, there will be increasing demand for medical care for the elderly. By contrast, while this demand will help small biotechs, there are other factors that put it at a less advantageous position, particularly financial. Venture capital is getting harder to find. Big pharma, while it's still interested in acquisitions, its appetite has decreased. And the increasing cost of research and clinical trials is obviously much harder for a small company with fewer resources than for a big company. So these are, some of the issues we might keep in mind, as well as some of our other panelists will be discussing. So let me just briefly explain the format we're going to use. The other three people will each give a speech. After that comes the more participatory part of the program, where we'll have questions and answers. I'll probably start by asking a couple of questions, but I really, really hope all of you will also have questions to ask. Once the speeches are over, please feel free to raise your hands if you have questions. As well, the panelists may ask questions of each other. As we do this, though, I'd just like to ask you to maybe keep three topics in mind, which I think are particularly key topics for our panel. One is a kind of practical business topic. We've got all this incredible research going on. When is it going to lead to practical results? Which disease targets maybe will we see genomic-based drugs first? Second is also pretty practical, and that has to do with the funding. What are investors looking for when they decide which of these promising, research targets, promising biotechs to finance? And the third is also very crucial, and that's regulatory. Are the regulatory agencies of the US, of Europe, of Korea ready for this, influx of very innovative, very unusual drugs that will, we hope, be arriving at their doorsteps? All right. So let me start then by asking, I guess, Mr. Suh, I think you were first up, if you would like to come speak now.
네, 여기가 한국에서 하는 세션이니까 저는 한국어로 하겠습니다. 사실은 아까 연사분들이랑 점심 식사를 하면서 간단하게 그 얘기를 했는데 미국과 유럽과 한국의 차이가 뭐냐를 제가 좀 이야기를 하고 한국은 현재 어느 자리에 있는가, 앞으로 한국이 나갈 방향은 어딘가, 이렇게 말씀을 드리겠다고 말씀을 드렸습니다. 자, 슬라이드를 넘겨주시겠습니까? 사실은 한국은 뭐 10번째라고 하기도 하고 9번째라고 하기도 하고 11번째라고 하기도 하는데 세계적으로 이미 경제 대국이 되어 있는 나라입니다. 그런데 불행하게도 한국이 경제 대국인 줄 알고 있는 전 세계 사람들이 많지를 않아요. 사실은. 그래서 가끔 가다가 한국이 경제 대국이라고 그러면 놀래죠. 저는 수출만 주로 하기 때문에 전 세계에 나가서 제일 먼저 하는 게 코리아라는 어떤 나라인가를 이야기합니다. 한국이 한국전쟁이 끝난 게 1953년입니다. 53년에 사실은 뭐 폐허가 된 나라였겠죠. 그리고 실제 이제 57년 지났습니다. 인류의 역사상 폐허에서 57년 만에 이 작은 땅덩어리에서 많지 않은 인구를 가지고 이만한 실적을 낸 민족과 국가는 없을 겁니다. 그래서 사실은 안타깝게 생각하는 것은 우리의 이런 능력을 세계도 잘 모르고 있지만 우리도 잘 모르고 있다는 거예요. 그래서 사실 조선 쪽 같은 경우에는 저희 나라 기업들이 세계 1위를 굳히고 있어요. 전자산업 쪽도 1위를 굳히고 있고, 자동차 같은 경우에는 한 11번째 위치에도 있고, 근데 헬스케어 쪽만 우리가 강하지를 못합니다. 그런데 외국에서 오신 분들을 위해서 우리나라가 왜 이 산업이 떨어져 있는가를 말씀을 드릴게요. 한국이 전 세계에서 가장 저렴한 의료보험비로 최대의 서비스를 받는 나라입니다. 예를 들어서 미국에서 맹장 수술을 하면 사보험 안 드는 사람 한 2만 5천 불 들을 거예요. 우리나라 돈으로 한 3천만 원 들죠. 3천만 원 들으면 우리 한국인 중에 병원 가서 수술할 사람 몇 사람 없을 겁니다. 실제. 그리고 미국에서 앰뷸런스를 보험을 안 드는 사람이 불렀을 때는 한 얼마 정도 드냐면 우리나라 돈으로 한 500만 원 정도 듭니다. 그런데 한국에서 911 앰뷸런스 부르면 무료입니다. 보험을 들었던 안 들었던. 그러다 보니까 한국은 헬스케어 산업이 저렴한 비용으로 최대의 서비스를 받게 하다 보니까 사실은 국내 시장 지향적이었어요. 그래서 그동안 이 부위가 크게 발달하지 못했던 겁니다. 그래서 이것이 한국이 기술 수준이 떨어지고 준비가 안 돼 있어서 상대적으로 약한 거라고 생각을 하면 안 됩니다. 예를 들어서 미국에서 의료보험비가 엄청나게 비싸죠. 그래도 아무 병원이나 갈 수 없습니다. 보험회사가 지정하는 병원만 가야 돼요. 그리고 더 큰 병원을 가기 위해서는 보험회사의 동의가 필요합니다. 한국에 있는 국민들은 의료보험 전 국민이 거의 다 들어있거든요. 그리고 어느 병원을 가든 어느 선생님을 만나는 환자의 마음입니다. 그래서 한마디로 말하면 국민 지향적 의료 서비스를 가지고 있어요. 그러다 보니까 이제는 우리가 탈피해야 할 때가 되어 있지만 모든 것이 무척 뒤떨어져 있는 후진 국가의 모형을 가지고 있는 건 아니다 하는 얘기를 먼저 드리겠습니다. 다음. 이제 사실은 한국은 그러면 어느 상태에 있느냐 하는 얘기를 하겠습니다. 여기서 많은 분들이 오해하고 있는 것을 하나 바로잡고 싶으면 공학과 산업은 다릅니다. 공학은 대학에서 하는 거예요. 산업은 기업에서 하는 겁니다. 공학은 연구 가능한 분야를 다 스터디하는 겁니다. 산업은 가능한 거를 현실화시키는 거예요. 그래서 그동안 이 바이오텍이든 케미칼 제약이 됐던 이 제약산업, 케미칼 제약이든 바이오텍이든 미국, 유럽이 주도했습니다. 그 이유는 그동안은 R&D 중심 산업이었어요. 막대한 R&D 투자비를 해서 특허로 보호를 받기 때문에 많은 이익을 냈어요. 그런데 이제 미국, 유럽의 기업들이 큰 위기에 봉착했어요. 그 이유는 새로운 신약이 잘 안 나오는 겁니다. 근데 그것도 정확하게 말하면 R&D 과제가 없는 게 아니라 그동안은 많은 환자들을 적용할 수 있는 아이템들을 개발하다 보니까 임상하는 개발 비용은 많이 들어도 수익성이 있었습니다. 근데 이제 그런 제품이 마땅치가 않아요. 개발할 제품은 많은데 적용 환자 수가 작은 것들만 남아 있어요. 그런데 임상 비용이 줄지를 않거든요. 그러니까 경제성이 안 나오는 겁니다. 그래서 미국과 유럽이 왜 위기가 오냐? 이 산업이 R&D 중심 산업에서 이제 인더스트리 중심 산업으로 바뀌었어요. 인더스트리 중심 산업은 퀄리티와 코스트 경쟁력이 제일 중요합니다. 그래서 현재 이쪽 산업은 미국과 유럽의 기업은 누가 뭐래도 위기 산업입니다. 그러면 한국은 어떠냐? 한국은 기회의 산업입니다. 그래서 미국과 유럽이 어려운 거와 한국이 어려운 건 전혀 상황이 다르다 이거죠. 실제. 그래서 여기에 이쪽 분야에 관심 있는 분이 많이 오셨을 텐데 사실은 미국과 유럽의 정보를 가지고 한국의 정보로 오판하시면 안 된다 하는 얘기를 하는 거예요. 그러면 이 위기, 이 기회가 언제까지 갈 거냐? 임상 비용이 현격하게 줄어들 수 있는 새로운 시스템이 갈 때까지는 한국이나 중국과 인도가 유리할 거야. 그러면 그런 시대가 올 거냐? 제가 보기에 상당히 오랫동안 오지 않을 거예요. 그 얘기는 미국과 유럽의 기업이 다시 서바이벌 하는데 어려운 허들을 가지고 있다는 얘기입니다. 그래서 이제 한국은 이런 측면에서 사실은 우리가 가지고 있는 장점들이 많이 있기 때문에 산업을 하기 위한 장점을 한국이 많이 가지고 있어요. 그래서 이 산업에서 후발 국가의 리스크를 줄이는 것을 하나 해야 되고, 여기서 생기는 이익은 우리도 역시 R&D에 투자를 해야 됩니다. 그러다 보면 미국과 유럽하고의 격차를 많이 줄일 것이다, 이렇게 생각합니다. 다음. 그러다 보니까 사실은 그동안 우리나라에서 개발 투자를 기업들이 많이 못한 건 사실이죠. 그런데 다행스럽게도, 이걸 다행이라고 할 줄은 모르지만, R&D 중심의 산업에서 산업 중심의 산업으로 넘기다 보니까 이 단점이 작아지는 시대가 왔다. 그래서 이제 우리나라에 있는 많은 기업들과 많은 학자들이 새로운 생각을 할 수만 있다고 치면 우리는 좋은 시기에 있다, 이렇게 생각을 합니다. 다음 페이지요. 그러면 어떻게 산업화를 하느냐는 얘기를 하겠습니다. 재미난 얘기 하나 하면요. 산업은 기업이거든요. 기업은 모든 장사가 똑같습니다. 김밥 장사나 라면집이나 큰 제약회사나 조선소나 똑같은 원칙이 하나 있어요. 바로 뭐냐면 이익을 내야 된다는 겁니다. 이익을 어떻게 내느냐? 그것도 간단해요. 고객이 찾아올 수 있는 기업이 돼야 됩니다. 고객한테 이익을 줄 수 있어야 돼요. 업종 불문하고 여기에 차이는 아무것도 없습니다. 근데 이 산업이 아까 제가 R&D 중심 산업이었다고 했지 않습니까? 근데 참 우리 옆에서 볼 때 좀 딱한 것 중에 하나는 R&D 다 좋은데 무슨 돈으로 R&D를 하시려고 합니까? 누가 주지 않아야. 그리고 모이면 맨날 정부 지원 자금, 인베스트하는 투자자 그러는데 우리 닥터 카우도 와 있지만 돈 안 되는 기업에 투자 안 하거든요. 그러니까 한국의 미래를 위해서 투자하는 외국 투자자가 없어요. 투자했을 때 은행 금리보다 이익이 높을 게 확실히 될 때 투자하는 겁니다. 실제. 그러기 위해서는 돈을 벌 수 있는 사업부터 시작하는 거예요. 그리고 벌어진 돈을 가지고 미래에 투자를 하는 겁니다. 이거는 모든 업종이 다 똑같습니다. 근데 이게 공학에서 산업으로 아직 완전히 넘어오지 못하고 있다 보니까 자꾸 허상의 꿈들을 꾸세요. 그런데 기회는 한국에 왔지만 현실은 정확하게 인식해야 된다. 그래서 제가 생각하기에는 우선 산업화할 수 있는 데에서의 우리의 장점을 살려야 됩니다. 거기서 이익을 만들어야 돼요. 그 이익을 가지고 우리보다 앞섰던 나라들이 투자하는 패턴과 같은 보조를 맞추는 것이 중요하다. 그래서 선택과 집중이 지원하고 전략이 중요하다, 이렇게 생각합니다. 다음. 그래서 이제 우리 한국에 있는 많은 기업들도 로컬 시장에 국한하지 않고 전 세계 시장으로 나가기 위한 연구를 하기 시작했어요. 준비가 된 기업도 있고 준비를 하는 기업도 있다고 생각을 합니다. 그리고 또 한국에 많은 학자들이 계시고 많은 연구 인력을 가지고 있고, 특히 한국인들은 바이올로직에 강할 수밖에 없습니다. 그 이유가 바이올로직이라고 하면 결론적으로 크게 분야가 프로틴을 다루느냐 아니면 미생물을 다루느냐. 물론 거기에서 진을 연구하면서 운용의 폭이 크죠. 그런데 우리는 모든 음식이 발효 음식이거든요. 사실은 우리는 오랫동안 미생물을 다루는 쪽이 생활화가 되어 있습니다. 그렇기 때문에 외국에서는 바이오리액터라고 해서 그거 비싸게 받거든요. 근데 엄밀히 말하면 한국인은 집집마다 바이오리액터 하나씩 다 가지고 있는 거예요. 김치 냉장고가 바이오리액터입니다. 김치독이 바이오리액터고, 그거를 스테인레스로 만들면 상업화된 거고요. 그거를 도자기로 만들면 집집에서 가지고 있는 거예요. 그래서 사실은 친숙한 분야입니다. 그리고 또 저는 원래 이 제약 쪽이 아니었어요. 의사도 아니었고 이쪽을 왔는데 재미난 거는 이 분야가 해볼 만한 분야입니다. 왜 해볼 만한 분야냐? 기술의 진보의 속도가 다른 산업보다 느려요. 그러니까 쉽게 말하면 충분히 전 세계 기술의 진보를 따라가는데 어렵지가 않아요. 그 이유는 딱 하나야. 장기가 안 바뀌어서 그렇습니다. 위는 여전히 위고요. 간은 여전히 간이에요. 그런데 IT 쪽 같은 경우는 프랩톤 자체가 막 바뀌거든요. 그런데 이 분야는 우리가 소질도 있는 분야고 우리가 충분히 스터디할 만큼의 스피드로 기술이 발전하고 있고 그리고 기술의 격차가 큰 것 같지만 크지 않습니다. 그래서 사실은 셀트리온 회사는 2000년에 제가 처음 만드는 회사입니다. 그때 저희 직원 저 하나였어요. 2001년에 6명이었습니다. 지금 현재는 전 세계 바이오로직 하는 회사 중에 탑 10 안에 있을 거예요. 그럼 제가 똑똑해서 그런가요? 그렇지 않아요. 한국이 그 사업을 하기 좋은 나라입니다. 여기 우수한 인력이 많이 있고요. 그리고 이쪽이 그런 걸 할 수 있는 한국이 인프라를 많이 가지고 있어요. 그 이유가 뭐냐면 반도체 산업과 바이오로직 쪽의 산업이 요소 기술이 비슷합니다. 그래서 똑같은 공장을 줘도 미국이나 유럽보다 한국이 30~40% 싸게 질 수 있어요. 그리고 똑같은 공장을 줘도 미국이나 유럽보다 한국이 공기를 3분의 1 정도 단축할 수 있는 인프라를 가지고 있다. 이렇게 생각하시면 되겠습니다. 6페이지로 가셔서요. 그래서 물론 저희 회사도 그런 전략으로 지금까지 해서 10년이 경과했어요. 그래서 그 결과 우리 생각이 틀리지 않았다는 것을 전 세계에 지금 보여주고 있습니다. 그래서 제가 이 세션에서 한국의 이 분야의 현실에 대한 진단은 저는 어떻게 생각하냐? 한국한테는 좋은 기회가 왔다. 그다음에 우리가 많은 잠재력을 가지고 있다. 이 잠재력을 잘 조합하면 할 수만 있다고 치면 이 분야에 그동안 연구했던 분들, 이 분야에서 사업을 했던 분들, 그리고 투자를 하는 투자자는 한국의 바이오텍에 투자할 수 있는 좋은 적기가 왔다고 생각합니다. 다만 제일 중요한 것은 현실을 정확하게 아는 거예요. 그리고 어디로 나갈 거냐 방향을 잡는 겁니다. 그리고 재미난 것은 하우투는 중요하지 않아요. 현위치만 정확하게 인식되어 있고 나갈 방향만 정확하게 잡혀 있다고 치면 하우투는 돌아서 가든 바로 질러 가든 차이가 별로 나지 않습니다. 그래서 오늘 이 세션에서 이제 전 세계의 이야기도 하겠지만 저는 어쩔 수 없이 한국에 대한 진단을 해드렸습니다. 그리고 우리가 토의하는 것들을 들으시면서 지금까지 연구하셨던 그리고 사업하시면서 가졌던 궁금증이 많이 해소되시기를 바라고 그리고 이 세션이 본인들이 결정할 때 혹시 판단하기 어려웠던 부위를 판단하는 데 조금이라도 도움이 됐으면 좋겠습니다. 고맙습니다.
Thank you, fellow panelists, ladies and gentlemen. My presentation will be less mesmerizing and will deal with the investment aspects of biotechnology. We've heard in various talks this afternoon and indeed over the last couple of days about the opportunities that have been created by the post-genomic era. And indeed, our new understanding of proteins and genes has in fact created an explosion of new applications in biotechnology, and really the effect of this new understanding goes beyond healthcare, and as pointed out by Mr. Lee previously, it really penetrates through all our lives, including the industrial area, in agriculture, the environment, and others. But let's stick to healthcare, and let's look at the global pharma sales. This is a chart of the global market for prescription pharmaceuticals, and despite the well-publicized problems that the pharmaceutical industry is facing, it's still a growing market. And this market has been driven by the drivers that I've listed on the left, which are really unmet medical needs, the aging population, expanding markets for drugs, importantly improving therapies, new discoveries and new advances. But I guess the thing to note about this chart is the blue bars, which represents prescription pharmaceutical sales in the US market, and you can see that in recent years, the growth in this market has been flattening out. The truth of the matter is that the pharmaceutical industry is under pressure. The industry is being weighed down by many issues, not least escalating healthcare costs, healthcare reforms, falling R&D productivity, falling capital efficiency, and the changing economic environment. Now, these pressures are producing new shifts and trends in the marketplace, which are all very important to all of us who are helping to build or invest in the biotechnology industry. Some of these trends are that the emerging markets are becoming more important. There is an increasing influence and penetration of generic drugs. Pharmaceutical companies are acquiring pipelines, acquiring companies, especially biotech companies. And the financing hurdles are getting higher and higher every day. I'll go through these. One key trend is that the geographical importance of markets is shifting. And growth rates of the pharmaceutical industry in terms of in more developed countries and the developing countries are diverging. In the developing markets, the developing markets will become a more important part of the global pie moving forward. And the takeaway from this slide is that by 2020, there are some predictions out there that say that China could well be the largest market for pharmaceuticals globally. The rise of generics is a very prevalent trend. This is a chart of the value of pharmaceutical patent expiries. Now, in other words, this is the annual revenue that is being lost by the prescription pharmaceutical industry as a direct result of patent expiries and as a result of generic substitution. And you can see that the numbers are quite enormous. And this trend, I think, is best illustrated by what will happen in 2012. And that will be the expiry of the patent for Lipitor. Lipitor is the world's largest selling pharmaceutical product currently. It sells in the region of $12 billion, and its patent will expire in 2012, and Pfizer, the company that sells the drug, will lose 90% of these sales. And as we've learned over and over again, this will happen virtually overnight. The penetration is well seen. In the chart on the right, you can see that in terms of volume penetration, some of the markets are seeing already a 70% penetration by generics. And this penetration is, in fact, very well marked out on the left chart, which shows a strongly growing value market for generic pharmaceuticals. One of the difficulties that the pharmaceutical industry is facing, I think, is very worthwhile highlighting, is the falling productivity. In this chart, the red line shows the industry expenditure in R&D in US dollars, and you can see that that has doubled over the time frame. But the number of new drugs approved by the FDA has fallen or at least remained the same in the last several years. So it's opening up a productivity gap, and pharmaceutical companies are struggling with this trend. So what are pharmaceutical companies doing about this? They are buying products. And the biotechnology industry has been a key beneficiary of this. As you can see on the charts, there has been a healthy number of biotechnology, pharma biotech transactions, pharmaceutical companies buying biotech companies, as well as pharmaceutical companies forming alliances with biotech companies. And this trend, I think, will continue in the years to come. In terms of financing biotechnology, the bad news is that many companies are finding this activity very, very challenging, particularly in recent years. Although the chart shows that in 2009, the total amounts invested by venture capital into biotech companies remains relatively healthy. There is a lot to be said about the chart there. There are more companies fundraising, which means that, in fact, fewer companies got financing in 2009. Many of the companies that got financing in 2009 were the larger companies, and they were through follow-on financing. Therefore, the new companies seeking financing found it extremely difficult to get funded. In terms of the behavior of venture capitalists, syndication has been incredibly slow, and protective provisions in their term sheets has been incredibly difficult. And one thing that the companies are all facing are low valuations. In terms of what's happening on the IPO markets, this is the initial public offerings. In biotech, you can see that activity in the IPO market has slowed markedly, both in terms of the number of IPOs coming to the market and in terms of the dollars raised. Critically, the valuations in recent years for biotech IPOs has been quite dismal. And in fact, in the few IPOs that have occurred this year, the valuation has been, at best, at a small premium to the last financing round. There are, in fact, two companies that have been IPO'd at the same valuation as the last financing round. This is in sharp contrast to what has happened in prior years, where the biotech IPO market had been extremely hyperactive, and companies were able to raise money on very high valuations, simply on a business plan, a platform technology, certainly without proof of concept. Things have got harder and harder, and the situation today is quite severe. And this rather austere picture of biotech IPOs will have knock-on effects to earlier rounds of financing. And venture capitalists tend to look at what's happening at the IPO markets to determine, what they want to invest in. And I think that this will continue to be a difficult market. So what are companies doing about this? Companies are responding. Many are going back and re-looking at their value proposition. They are looking at a business model that will leverage the existing partnerships and critically try to gain early revenues to bring in to fund their burn rates. There's now a big focus on both cost efficiency and capital efficiency. And we are in fact seeing some companies moving to Asia to leverage on capital efficiency. The cost of doing business for biotech companies in terms of hiring scientists, in terms of doing clinical trials, are considerably lower in Asia compared to what you might find in the US and in Europe. Now, let's take a look at Asia. The biotech industry in Asia is in fact coming on very well. There has been significant investments in infrastructure. There's a lot of government investment at the academia and basic research level. if you look at patent filings or peer-reviewed publications, they are rising, and the quality of those are rising as well. There's increasingly good scientific projects. We see it all the time as investors. We see business plans being more and more robust with better and better technology. However, I would say that the issues that are faced by the US and European counterparts are also reflected in Asia. In other words, there is insufficient venture capital for biotechnology, and there is generally poor access to capital markets for these companies. I'll finish off by saying a few words about what Singapore is doing. You may have heard that Singapore has made biotech a big focus in its industrial outlook. In Singapore, they have a pretty fixed focus. They look at three things: healthcare services, medtech, and pharma and biotech. And within these three subsectors, they also want to do three things. The first is to enable innovation, i.e. promote R&D. The second would be to attract manufacturing into Singapore. And the third would be to use Singapore as a launch pad into the rest of the Asian markets. In terms of manufacturing, Singapore's been able to attract a high level of interest from multinationals, and this is mainly through very attractive incentive packages. On R&D, the country has been has not perhaps attracted the same level of interest as manufacturing in terms of the multinationals moving over, but there's clearly some momentum there, and I would say that there is a growing number of local companies which are doing privately funded R&D. In terms of market access, again, good momentum there in what Singapore is doing, and there is increasing number of multinationals making Singapore their Asia-Pacific regional headquarters. So that really concludes my talk. Thank you very much for your attention. But before I step down, I'd like to share some good news with you. The good news is that, in the biotech and pharmaceutical industry, we tend to be known as the bad guys, and possibly because, biotech and pharmaceutical companies charge very high prices for their products, particularly to people who really need them. But I'm happy to say that we're no longer the bad guys, because there is a new bad guy in town, and the new bad guy are the oil companies. Thank you.